days are getting shorter, the leaves are changing color, the wind is starting to blow, and that can only mean one thing. It's time to renew the shows that we do.
I like that.
So here we are.
I thought you were going to say it's time for football. But that being said, welcome back to It's Your Health. It's been a while since we've done some shows. We got a ton of stuff to go over with you. We'll be right back after this brief commercial message. Remember to check with your healthcare provider before doing any of the things that we do here on It's Your Health. Be right back. You're watching It's Your Health, your leader in healthcare information. We have not done a show for some time, so I've been saving material for all summer. It is jam-packed. I know at times...
You really haven't been saving it for all summer because he gets the most recent, up-to-date information for on the show. So some of the stuff he saved in June and July, he's not using in this show.
But I just wanted to inform you that we can't be too chatty because there's a lot of material. And just to let you know,
What are you looking at me for?
I brought this little bell. And I'm going to ring the bell when you get a little too chatty. That's a sign just to kind of, let's go to the next topic.
I didn't agree to that.
Well, it's...
I didn't say I would respond to the bell. I'm not...
Okay. Moving right along.
The first headline, third-hand smoke takes hold. Concerns are being raised about third-hand smoke, which is defined as the residue that clings to surfaces after a cigarette has been extinguished. Nicotine from the smoke sticks to indoor surfaces, which we all know it's hard to clean up, and reacts with nitrous oxide in the air to form carcinogens.
Yeah, it's unbelievable. Of course, you know secondhand smoke is bad, and now we're finding that third-hand smoke, when you go into someone's automobile after they've been done smoking or into their house, those things are bad. Another reason to get rid of that nasty habit.
Then you don't know if you're going to touch something, you put it in your mouth, you know. All right, I'm going to the next headline. That's all I'm allowed to say. High coffee intake tied to lower diabetes risk. This sounded really good until I read the whole article. Drinking 12 or more cups of coffee daily was associated with a significant reduction in the incidence of type 2 diabetes. It was significant only if you drank 12 or more cups a day. If you drank less than 12, it wasn't significant.
Yeah, that's pretty unbelievable, and I don't think anybody's going to do that. I'm not sure the mechanism of action. I think the point is caffeine used to be like eating meat on Friday. It was something bad, and now caffeine isn't bad at all.
Did you hear that? I'm gonna tape that when I get home, and I'm playing it over and over and over for him, so that he can keep hearing himself say,
for my Coca-Cola care. The bell has rung.
Number 3, flu vaccination for all adults endorsed for this season. We just got ours, didn't we?
Yes.
They're here. The recommended target groups for annual flu immunizations have been broadened to include the whole population. Starting this year, everyone aged 6 months and older should be taking the vaccine, especially those between the ages of 19 and 49.
Right. Before there were restrictions, guidelines for the flu shot. If you are walking and talking, you ought to just get it and be done with it. And it's out early this year. We don't expect the shortages or the issues like we had last year.
Do you get the flu from the flu vaccine?
No.
People say that all the time.
No, they don't. It's a dead virus, at least the shot is. And you can get a flu-like reaction. That kind of means it took. You remember when you had your smallpox vaccination? It actually erupted into a smallpox reaction, and that told your body to make antibodies against smallpox, which of course we don't see these days. Same thing with the flu shot. It's not going to give you the flu, although some people may get a mild reaction. That is flu-like.
That's doctor speak. Next headline. Long-term metformin raises risk for B12 deficiency. This commonly prescribed drug for patients with type 2 diabetes induces vitamin B12 malabsorption and can raise the risk for B12 B12 deficiency?
Yeah, it's very interesting. Metformin, glucophage, a lot of people on that for type 2 diabetes. It's a great drug. But you should get B12 levels checked, and you can take all the B12 you want orally. It's just not going to get absorbed, hence the B12 shot.
I don't even look at the next picture.
Oh, yeah, how do you like that?
I don't. You do. You do this one.
Okay, I know that looks horrible.
It does.
But that's called a geographic tongue. The tongue can often be a manifestation of certain diseases, one of which is B12 deficiencies, by the way. This is a benign condition for how ugly it looks. It's going to go away with time. But if you notice anything with your tongue, it may not be a benign condition. You can get white patches on your tongue or infections on it. So bring any tongue disorders to the attention of your family.
And
doctor.
if you have a good dentist, either he or the hygienist will check your tongue at every visit. Top, sides, bottom, will look at your tongue carefully.
Good point.
Thank you. Okay, now there's a new cervical cancer coverage. It's called Cervarix.
Well, it's kind of new. It's just a different name of what we would be promoting for the...
I wasn't finished.
Oh, okay, go ahead.
Never mind, go ahead.
Can I take this home? Do you think I can take this home?
Yeah, I know right where to put it.
Okay. Okay. What we're talking about is a vaccine against the virus that causes cervical cancer. Young women out there in television land of reproductive age, you need to really look into that and get vaccinated against potentially lethal condition. Can be prevented by this vaccine, cervical cancer.
Absolutely, absolutely. And someone asked, what causes a beer belly?
Well, it's not beer. I think it's the calories.
Oh, of course not.
It's the calories in the beer. And of course, when you're drinking beer, you're usually eating junk anyway. So it has to do with calories and your distribution of fat. Some people are pears, some people are apples, but the beer is not doing it.
Well, the one thing I found interesting is that your liver is so busy taking care of the alcohol that it doesn't take care of the fat in your system. So it's a trade-off. I thought that was very good.
That was interesting. And we've already done with the first segment of...
I need to talk about waist circumference then when we come back.
Okay, when we come back, we'll deal with that. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back after this brief commercial message. Thank you. Welcome back to the fastest 30 minutes in television history.
You want to say that over again?
Yes.
Or did you think it was perfect just like that?
Welcome back to the fastest half hour in television history. Of course, you're watching It's Your Health. I'm here with my bride, who will guide us through the maze of medical menageries.
Did you hear what Sam just told us?
No.
About his parents
I think that was a HIPAA thing. You're not supposed to disclose that.
on vacation for their anniversary?
Well, that's nice. I think every day is our anniversary. Don't you realize that?
Headline number one.
Okay.
A randomized trial of Tai Chi for fibromyalgia. And they conclude that Tai Chi may be useful and merits more study.
Fibromyalgia, painful muscles, very difficult to treat, much less control. And like anything, exercise will help it. So you may want to look into that.
Okay. No. In women, depression and obesity are linked. Not for men, though. Women with depression are 54% more likely to become overweight or obese within 5 years of the onset of depression. And women who are overweight are more likely to become obese. So it goes both ways, but that doesn't happen with men. So you have to deal with...
Well, what's the chicken, what's the egg?
Yeah.
And so it is very difficult to treat someone who is overweight and is depressed, because one of the ways of treating depression, of course, is exercise and concern over self-body image. And it's almost like chasing your tail. You end up being depressed.
So you eat.
You get comfort foods, and then you gain weight and you feel more depressed. Very difficult. And, by the way, some antidepressants can be linked with weight gain, which makes it worse. So It's tough. It's tough. I think you need to join a gym or do something very proactive.
Headline number 3, physicians are neglecting hypertension guidelines. Physicians may not adhere to current recommendations due to a lack of awareness about them or because they didn't realize the guidelines changed.
That's true. We're doing a bad job at diagnosing and treating hypertension. The old way was the first number was allowed to be 100 plus your age. That's gone by the books. You should be around 120 over 80 or less. And we're not pushing the medications. We're not pushing our patients. And what you need to do is to buy a blood pressure cuff machine at home, take your blood pressure at home, and bring these numbers in and bring them to the attention of the doctor and say, we need to do a better job. So you have to push us. We're not doing a good job. And we also need to empower our patients to measure their blood pressure outside the office. You just can't come in once every 3 months, check your pressure, and decide, I'm controlled. Expend the $50, get a blood pressure machine, and take it at home.
And take some advice from me. I was using a blood pressure machine, but I brought it in to make sure that the readings I was getting were correct. Well, they weren't. When the blood pressure machine was checked here, it was a crappy blood pressure machine.
Yeah, you get what you pay for, but we can calibrate them.
He bought it for me.
That was an anniversary present.
Oh.
Okay.
So they should bring that in too the first time.
Absolutely, yeah, bring that in.
Okay, vitamin D deficiency, which we're hearing a lot about, is now common in teens. Supplements need to be considered for all adolescents. One study found that 15% of milk samples had no vitamin D in it, even though the carton said they did, and more than half had 80% less than what the carton said they had.
Not surprising. Our kids are not outdoors playing anymore. They're inside on computers, video games. They're not getting sunshine. Nutrition is a big issue, of course. So it's not surprising we're seeing vitamin D deficiencies in our teenagers.
And they're not eating fruits and vegetables.
No doubt.
I have a question somebody called in.
Go ahead.
If I have mild asthma, is it okay for me to use inhaled steroids?
Yes, it's a good idea to do that. Inhaled steroids generally don't get absorbed like the oral ones do.
What are they?
They're aerosol treatments that have some prednisone-like material in it. Calms down the inflammation, the congestion of the lungs, will really reduce your asthma attacks as we enter in a seasonal allergy time of the year. So yeah, inhaled steroids are key to controlling asthma.
I'm not doing anything with this next one. I don't even want to look at it.
Well, I know this is a rough picture. This is what shingles looks like. It's a severe case. It involves the scalp. Shingles, of course, is caused by the chickenpox virus. It becomes reactivated, runs down one side of your body's nerve root. Could be the face, the chest, sometimes the eye. And the key thing here is this is preventable. You can, out there in television land, get a vaccine shot that generally is paid for by your Medicare prescription service plan, and you can prevent the shingles, and people who have had shingles, who have the pain of shingles afterwards, are miserable. So one of the things you ought to look into, treat yourself to a shot to prevent this type of reaction, shingles.
My mother had shingles on her back. She really suffered. But how old should you be to get this?
You can get it nearly at any age. We generally like to see it in the elderly because that's...
Well, like what age you talk? When you say elderly,
how old are you?
none of your business.
Okay, I would say 50 on, but although you could get the vaccine if you are younger. But as a rule, the older you get, the more likely you are to come down with shingles.
Do you have to get it again or does it last?
One and done.
Okay, speaking of one and done, Bayer 81, are our physicians remembering, even though it's not a prescription drug, to prescribe it, so to speak? And how about to our postmenopausal women? Are they being told to take it, or is it just being told to the men?
As this poster implies, what we're missing is 81 milligrams of aspirin. Anybody over the age of 50 or anyone who has underlying hypertension, diabetes, high cholesterol should be taking a low-dose aspirin, men and women. It's been modified a little bit. You should be actually taking 2 if you have underlying heart disease. But an aspirin a day will certainly keep the doctor away. Check with your doctor. We don't want to give you an ulcer in the meantime, or it could interfere with other blood thinners you're on. But
Gee, should I be on it?
yes, you should be on aspirin.
I should ask my doctor. Oh, brother. Okay. We were talking about beer bellies. Now we're going to talk about beer is linked to the skin problem psoriasis. Unless it says light on the label, the frosty beer you drink may increase the risk of developing psoriasis, a painful skin disease that afflicts more women, according to a study now online that will be published in December.
I'm not sure the mechanism, but we do see psoriasis and alcohol together, along with other diseases. So if you have a skin disorder that's itchy, or you have plaques of psoriasis, you ought to cut out the beer.
And the only one they find that problem existing is the non-light beer. Right. It doesn't happen if you drink light beer. So that was interesting.
Well, what is interesting is you've gone through our second segment here of It's Your Health. We're going to be right back after this
finished.
Brief commercial message. We're going to be right back. Remember, you're watching It's Your Health. It's your leader in healthcare information. Be right back.
Welcome back to the final segment of It's Your Health, and I'm here strictly to read.
And not entertain us or inform us?
Nope.
You're kidding. That's for later tonight. Okay.
Oh, it's definitely not.
Well,
but there is something I plan to do with that bell.
Okay, our public's awaiting, sweetheart.
Okay. The first headline: Ginkgo biloba does not prevent dementia. Findings have dispelled the notion that this popular supplement prevents dementia or Alzheimer's. Taken twice a day, it was not effective in reducing the overall incidence of dementia, or Alzheimer's. Did not.
Yeah, everybody's key on that drug. I'd be careful of it. It not only has side effects, but it is not a medicine you should take with other medications. It can really kind of have drug interactions.
Oh. Berries may slow mental decline from aging. If ginkgo doesn't do it, maybe berries will. And we've heard for a long time berries are good for us, but compounds found in various berries and maybe in walnuts may slow down natural aging processing in the brain, according to brand new research. They may help the aging brain in a crucial but previously unrecognized way, taking away trash, so to speak, that's in your brain and cleaning it up.
Not surprising. When I talk to my very active 85-year-old plus patients, guess what? They're out picking mushrooms, they're out picking berries, huckleberries, swampers. So I think that's the real deal.
Oh, and we have something else on dementia. I think, if I remember. Anyway, 2 studies find antihypertensives may reduce dementia risk.
Not surprising, because the blood pressure can accelerate certain dementias, one of which are vascular in nature. So there is a good chance you're out there listening to us with uncontrolled, or undiagnosed, and untreated hypertension. And if you are hypertensive, there's a good chance you're not being controlled. So check with your healthcare provider, get that under control, and you will certainly lower your risk of a dementing illness down the pike.
And as most of us know, when he talks about hypertensive, we're talking about high blood pressure. And so if you're taking the drugs to help your blood pressure, chances are you're reducing your chances for dementia.
I thought I said that.
I said it more clearly.
Okay. Do we have a bell to
Number 4.
Make you go faster now?
Postnatal depression, fathers have it too. The overall rate of paternal depression between the first trimester of pregnancy and 1 year after birth was over 10%, more than double the normal rate of depression in men.
Well, postpartum depression, very serious in women, but what this study suggests is that guys can get it too. And they don't always have the same symptoms and are harder to diagnose and will be less willing to seek treatment because they're guys. So you got to be careful out there in television land.
Yes, symptoms of their depression might be withdrawal, anger, and irritability. Okay, how many men can you think of that must be depressed then? A lot more than 10%. Okay, what do we have here? Something for postmenopausal women?
Well, yes.
Well, no kidding. New low-dose Vagifem, 10 micrograms.
Well, we're not using estrogens a great deal, as you know, but they have formulated this tablet that is inserted in a woman's birth canal, which can really lower the incidence of dry tissues, if you will, and it's something you ought to think about. Talk to your gynecologist. It's probably safe.
Probably.
Well, the estrogens, they are controversial because if they get absorbed, they can induce breast cancers, elevate your blood pressure. They're not candy.
Well, my gynecologist told me that it is such a small amount that there's not enough of it to get past the place where it's supposed to work and move along into your body. So I think she probably knows.
Okay. Agreed.
Okay. A simple device may help in diagnosing concussion, especially with football players on the sidelines.
You're going to start seeing this tool. Here's a picture of it. You hold a ruler with a hockey puck at the bottom, and the guy releases it, and your job is to grab it before it goes down too far. And by measuring how far you've let that hockey puck fall, that can actually tell us how bad your concussion was. So you're going to start seeing more of that.
Okay. And finally, pets in bed. Yes, it's okay to have pets in bed as long as it doesn't disrupt your sleep. Of course, we have one who snores. Sleeping with pets is not unusual in this country. Half of all owners sleep with their pets, especially people who have dogs, and more than half sleep with their cats. There is no issue about having a dog in your bed. Some people actually feel safer or calmer. Some people fall asleep more quickly with the feel of the dog's rhythmic breathing against them, which I agree with. And so the more dogs in your bed, the better you're going to be and the healthier you're going to be. So get more dogs.
Well, I can remember one night I was in like a fog, and I reached over and said, I think you have to shave your sweetheart. But that being said,
he's always in a fog.
We'll conclude our last segment of It's Your Health. Thank you for allowing us to come in to your home.
I had some other things I wanted to go over.
To inform you and
I
entertain
had some
you.
things that they probably would like to have heard about, because it was interesting.
They're going to have to call you at your shop and find that out. Remember Kathleen's Collectibles in Whitehaven. The best of antiques. But thank you for joining us, and join us again on It's Your Health, your leader in healthcare information.
That's us.